Our last panel today is going to be on labor issues. So we have folks from Delaware Department of Agriculture with Kenny Bounds. Let me get you up. There's Kenny. And from the Department of Labor and Sherese. Let's see if I can find you. I'll work on that, but Kenny, I think you're up first.
Very good, Gordon. Thank you, and hello, everybody. Gordon, it's been a great morning, Gordon and everybody. Great presentations. So I'm certainly glad that you've got the government on last to get it all straight, Gordon. And we won't be accepting comments on that at the end. But we do have Dave Marvel with us also to clean it up. He's the farmer with the last voice. But as we all know, 2020 has been a real challenge to us. But as always, agriculture stepped up to the plate. You know, we had some temporary disruptions to our food supply, but it didn't take us long to adjust. In the end, we worried more about toilet paper and paper towels than we did fresh fruits and vegetables and other ag products, meats, etc. You know, we figured out how to supply ourselves locally and regionally. And also we have some folks that participated in supplying food banks and other nonprofits throughout the Northeast. So Delaware played a big role in feeding Americans in this pandemic. It always felt, you know, it always feels, and especially this year felt reassuring to everybody to visit a local market, you know, farm stand or farmer's market, and find the kind of quality and abundance of food that we have. We're really blessed here. And I sure hope the population has learned to appreciate our farmers even more during this past year. And I certainly look for that trend to continue. I hope traffic at our farmers markets and fruit stands is up into the future. And I really do hope that folks, when they go into grocery stores and pick up food, that they have some new appreciation for where it came from. I want to give a shout out to the farmers for being able to produce food, you know, under these kind of conditions, and also still maintain compliance with some of those regulations that are important and that we can't give on. And one of those I'm thinking about is worker protection. You know, our pesticide section performed a lot of inspections throughout this pandemic and found really excellent compliance. Any issues we had were small and fixed, you know, right out in the field. So that was certainly good news. It's obviously essential that we protect our workforce and the communities in which they live, either as permanent residents or while they're visiting, from COVID-19. So Delaware Department of Ag is going to be partnering with the Delaware Division of Public Health in addressing vaccination of our workforce. Food and ag workers are included in phase 1B for COVID-19 vaccination priority. Division of Public Health expects that 1B will begin at the end of this month or early February using a phased approach. High risk, essential, and critical infrastructure workers, such as food processing workers, and those with a high risk burden will be the first priority. Those receiving the vaccine are going to have to make sure that they have a 15-minute observation period after the vaccination, and they'll need to return in either 21 or 28 days, depending on which vaccine was used for a second immunization. The DDA is working with public health to set up a vaccination clinic for agriculture. You'll see press releases from us coming out in the future when we get to that point. And there will be a mechanism for you to register to make sure that, you know, we meter the number of people at each location appropriately and have enough vaccines on hand. I think we've all heard, and we heard earlier from a presenter about how those vaccines have to be handled carefully or we can ruin them. We've already reached out to many agriculture groups to assess the need for vaccines and to try to judge how many, you know, what kind of count we're going to have. I'm sure a lot of you have already been contacted by Farm Bureau or DPI or others about that, and we circulated a survey to try to get a handle on it. We need Delaware farmers this summer to make sure their guest workers that are coming into the area are vaccinated with 2 doses of vaccine before coming here. I know that gets tricky, particularly with brokers involved. But if they're not, they'll need to partner with Sherese, who will be on next, and Department of Labor and West Side before they start working. So she'll talk more about the importance of that. But we need to keep our families and communities protected and make sure that those folks coming here have been vaccinating. We should also continue to follow the guidance issued last season. And again, Sherese has that detail. She did a phenomenal job of putting that together for guidance for folks, for migrant seasonal workers, to ensure everybody's safety. I think until we're really sure that we got this thing knocked back, we need to continue all those best practices that we're all sick of, but that are essential in trying to control the spread of this thing. So thanks to everyone at the department. We're here to help you, truly here to help you. If you need something, give me a call, and we'll make sure we try to get it done. So I'll now turn it over to Sherese for her presentation.
Good morning. Good morning. Thank you so much, Kenny. Can you all hear me?
Yes, you're good.
Yes.
Okay, great. Wonderful, wonderful. I bring you greetings from the Delaware Department of Labor on behalf of Carol Hubbard, who's our acting Secretary of Labor right now. But I also want to just say thank you so much to Gordon Johnson for extending the invitation, and Dave Marvel in their leadership roles, and certainly Kenny. All of you have been wonderful to work with during this pandemic season and on an ongoing basis, and we really do appreciate and we require the partnership. So what I want to do today is to give you a bit of information about what we do at the Department of Labor. A number of you we work with, some of you perhaps maybe we will in the future, but to talk a bit about what the programs are that we oversee, the guidelines, and why it's important. I'll stop there for a minute and just say to you, what I bring to this particular job is a passion for farmers and agriculture. I am a native North Carolinian farm girl coming from a working farm. Growing up, we owned the farm. We had soybean, corn, okra, as well as we call them hogs down south, and what have you. And that's what we did during the time that I grew up. And so I have a deep appreciation for the needs of farmers and exactly what it is that you're experiencing throughout the year. So I appreciate what you're doing. Along with that, as it relates to the Department of Labor and the work that we're doing there, is that we oversee 3 programs pretty much. One is our Migrant Seasonal Farm Worker Program, which are individuals that would come to the state to assist us from the contiguous US states, all of the 50 US states that would come in locally to assist you on your farms and request that, and then oversee all of the federal guidelines and regulations as it relates to that work. We also oversee the foreign labor certification programs, where a number of you are also participating in that, where we have individuals who come from other countries to the state of Delaware to provide labor and services in from agriculture to non-ag jobs. And then we also oversee some of the PERM certifications, which are the H-2B, H-1B, which are individuals that may come into the state ultimately where we have skill shortages. I mean, they may be in the professional and paraprofessional areas, but as it relates to our conversation today, it's around those individuals that come in primarily for the ag, and in some instances, non-ag related, nursery, those kinds of things and what have you for us. In doing so, we do everything from soup to nuts, I would say. We before coming in, we help you with your paperwork in terms of making sure those regulations are in place. We have to authorize that before those individuals are authorized to come here. If individuals that are coming here who cannot leave to go home at the end of the day to their native homes, we have to ensure that there are housing for them, suitable housing. So we do housing inspections along with our partners at Public Health to ensure that those things are in place before those individuals. And we have to say that that's okay before they're actually able to come off. So there's a whole series of certifications that we do and authorize. When individuals are here, our responsibility does not end in that many of you've seen us come out. Oftentimes I will come out as well as a senior administrator. It's okay. Again, I'm a farm girl. I will come out with my team who is comprised of Dawn Pickett. She's on this call as well on the Zoom meeting, who is our state monitor advocate. We also have Camille Nieves, who is our foreign labor certification officer. And we have a new gentleman. I said we were able to finally diversify. We went from all women to we now have our male representative, Mr. Nelson Irazo, who is on with us. He is our outreach worker. So you may see any hybrid of the two of us, the three of us, or what have you, that will come out periodically to the farms just to talk to you as employers. We'll do that periodically, as well as talking to the farm workers to see how things are going with them, and also connect them to services, skills, and services that we have at Department of Labor, or to determine if there's some other things that they may need in terms of our network of providers, whether it be healthcare, et cetera. Kenny spoke to you about one of our key initiatives during this pandemic, which was to ensure that not only the workers were safe, but that the community was safe, the employers were safe, and that, you know, you were doing what you could do as it relates to managing within this pandemic. As I said, those coming as migrant workers within the contiguous US states were coming from many states, particularly those states down south that were experiencing some extreme increases in COVID-19. And as such, coming to the state of Delaware, we did not have a really good sense about their vaccination protocols, their testing protocols, you know, that kind of thing. And so we worked with the Division of Public Health, Department of Ag, Dave, and a number of others around helping us understand specifically what the needs are, what's happening, and also is in terms of looking at some advisory information to provide to you in how you approach your work with individuals. I think it was a rousing success. We all know that COVID testing is not something that's mandatory, but we followed the guidelines as it relates to the Centers for Disease Control, as well as our own state public health, in encouraging individuals to be tested, and in the event of positive tests or other issues, that you were clear about what protocols were needed in order to segregate individuals, quarantine, and to make sure everybody was healthy, and et cetera. We had a few cases, not many, and I think that had a lot to do with the preventative measures, the cooperation, which we thank you significantly for doing that, along with us throughout the pandemic. It's not over yet. And as Kenny said, we really want to continue to practice those guidelines. I have provided that healthcare advisory to Gordon, so he can share that with all of the participants. We don't have it up on the share screen, but to share that with all of you once again, just to remind you. And then also, we provided fact sheets on the foreign labor certification programs and the migrant seasonal farm worker programs, along with our contact detail. And Kenny and Dave know this. I have them on the back dial. We have a speed dial for each other, and we speak not only during the traditional hours, but you all know that farm work is 24-hour-a-day work. So as needed, we communicate so that we can ensure that we're trying to meet the needs as much as possible of our employers, and also of the farm workers that are here in the state. I'll stop there because I know that Dave is going to speak as well, and also offer any opportunities if individuals have questions. Thank you.
Thank you. Well, from the farm side of things, and I'll just hit around a little bit. You know, none of us want more regulations than we're already dealing with. None of us want more paperwork, you know, but on the other side of that, none of us want someone to get sick or hurt from anything that we do. And none of us want any one of our family members or workers to get sick or hurt from anything we do. Luckily, with Sherese's group and West Side family, Sherita and Kenny and Richard Wilkins, Farm Bureau President, we were all on a lot of calls this past summer, mostly concentrating on the poultry plants, but also because that was the beginning of the seasonal workers coming in for watermelon season and such. And a lot of that information really just transferred over to that group. And it was a learning experience for all of us. You know, we were worried about basically contracting COVID while they were working. And then you got to realize that a lot of them live in confined areas and, grouping up together. A lot of them live in large families, and all those things had to be, addressed and evaluated and such. And luckily, as Sherese said, we all worked together to kind of work through that. It wasn't one of those incidents where everybody kind of threw their hands up and said, we can't do this. Everybody kind of joined hands and said, we got to do this. And that's kind of where we all came together and, worked through this. We're still learning. I think one of the questions is, will workers be required to have vaccination? And I believe they will, unfortunately. So how do we address that they've been vaccinated? Those are the things we got to work through. Because then you run into privacy laws, and you run into this, and you run into that. But if we're going to be in this business, then these are the things we have to address and be honest and work through that. And luckily, our state has really worked together with the government part, but also the private, and to work through all this. Some states didn't have that communication channels and basically hit roadblocks. And luckily we had a little bit of time because a lot of our seasonal workers came in later. So basically Florida and Georgia got hit first with it, and we learned from them. So, but I just wanted to, thank Kenny and Sherese and a few other people that were always on these calls. They were 2 to 3 times a week there for a while. And I liked seeing them, but I didn't like seeing them in those circumstances. Even the governor was on there a couple of days talking with us. And, at least our state is willing to work together with the farmers. And as a farmer, I appreciate that to you all.
Well, we love you too, Dave. And I just want to say that we will continue to work together as it relates to, trying to figure out what we do as it relates to the vaccination process. I think that, just from our perspective, speaking that, anything that we can do to try to help ensure and encourage safety, and we'll be working also with our regional and national entities around that. You're right. When you talk about privacy issues and things of that nature, it's a personal choice if you want to be vaccinated, but it's also a choice, an employment related choice, or it can be regarded as employment related choice if you are going to come into contact with other individuals. And no one has the right to be able to make other people sick or to expose persons unnecessarily. So we'll work through that the same as we did with the COVID testing and also protocols, to see what we can do to try to encourage our workers and also work with our employers and our providers, most importantly, to ensure that I would like to see us, try to reach 100% as it relates to vaccination, but looking at, will we have the capacity? Will we have the resource in terms of vaccinations, in terms of actually having the vaccinations here and what have you, or having the drug here, those kinds of things, to make sure we get things done. So it sounds like we're going to be having some more calls in conversation in order to get this done, and we're willing to be at the table.
And I just wanted to throw out for the audience that these things are going to be changing. Some of the protocols are going to be changing. Some of the rules we all have to follow are going to be changing. So stay tuned on that, because none of us know everything. I tried to convince my wife I do, but she doesn't believe me. So, but anyway, so stay tuned for that, and any information that our little group gets together, and through Westside and through the migrant seasonal workers group, we're going to be passing that along through either the newsletter or I don't want to throw Gordon under the bus on that stuff, but get up with one of us, and we'll try to get you the information you want, because pretty soon, it's going to be coming into play, because it's already mid-January, so a couple more months you're going to start planting, and then you're going to start thinking ahead of the harvest time. And that was our biggest concern last year during planting season, was, were we going to have the crews to harvest? And luckily we did. But there for a while it was a little scary, because you didn't know if they were going to be allowed to come up. quarantined for 14 days and not working, and such like that. No one knew. So, but anyway, so stay tuned for that. And I'll turn this back over to Gordon.
Okay, I think you did address the one question we had, which was from a farmer saying, will workers be required to have vaccination? I'm assuming he's talking about farm workers.
Yeah,
I think what I would speak to that a little bit to say that we've not gotten to that point, Gordon, where we've said, you're required. But as Kenny said earlier, when the state, I think, is looking at their rollout and their protocols for the level of individuals, who get it and the planning for it, that the governor's office and healthcare, along with the healthcare professionals, has begun to understand the importance of making sure that people in this industry are given some priority. And so we'll continue to inform that dialogue also to make sure, again, it would be wonderful to hear from all of you all, as well as stakeholders, certainly as we're, embarking on this journey around your thoughts. I know one of the challenges that we had during the COVID season is that, individuals could say they didn't want to be tested. We try to encourage them with education and those kinds of things, that it was important to do so, particularly when in many instances we knew that this disease was shaping and morphing on an ongoing basis. And oftentimes individuals were asymptomatic without showing any signs of disease at all, or sickness. I will tell you, in some of the instances that we found COVID positive cases, oftentimes you all will also mix individuals from the community along with individuals that come here from other states or other countries. And at times it was individuals from the community that were positive and not necessarily the other individuals. So just having some awareness about those kinds of things and the disease in general, and the vaccine and the protocols and the safety around the vaccine, I think will help people make some informed decisions. I don't know what you think, Kenny or Dave.
No, I think you said it right, Sherese. You can't force individuals individually to take the vaccine, but as an employer, that'll be interesting to debate and see where we land there on what those rights and responsibilities are for folks coming up. We certainly would hope that everybody is vaccinated, that everybody sees the merit in that. But if we do have somebody that just refuses, I don't know that right at this minute we're prepared to answer that question, but we will be prepared to answer it.
Yeah, and also on that, if some of them last year, said they already had COVID, so do they have the antibodies that would actually be just like, serum now? We don't know. We're saying yes, but we really surely don't know yet. And so that's another thing. If they've already said they've had it and they're not worried about the vaccine, then what do you do?
Well, Dave, I'll tell you that, no, what we learned about that in talking with the healthcare professionals in public health is that just because you have had COVID and you have an amount of antibodies, it is not monolithic. It changes from person to person. So, they were encouraging individuals to continue to follow the protocols, continue to consider certainly testing or, as we move forward, I would say vaccination. No one is immune from this disease. And since this has happened, we all now know that there are other variations of COVID-19 that has come about, and et cetera. So I think that, what I hear nationally and locally is that we are all at risk potentially for exposure to COVID-19. And as such, whatever you would like to do, with counsel within your own personal, consultation with your healthcare providers, it is a very personal decision. However, I tend to begin to think about this in a way similar to what I do when employers are practicing safety protocols, and you're saying to employees, you can't come to work intoxicated and handle heavy machinery, et cetera, et cetera. So just some thoughts out there. We'll get to a place that we can all live with. and then look at what we're saying at the national level and certainly seek legal counsel and all of those things to make some good decisions.
A comment from Dr. Neal, who we heard from earlier. She said that even if you had COVID, the recommendation is still to get vaccinated.
We're still learning.
Yeah. Yeah, so nice to have that presentation earlier that gave you some of the science behind. All right, any additional questions? I just, one quick question. We had a little bit of confusion or issues with the H-2A program last year. I'm assuming they've been worked out, or what's the status of the H-2A program?
H-2A program is up and running, and I'm not sure what you were saying as it relates to confusion. Can you talk a little bit more about any concerns?
Well, at the beginning, they were, turning people away at
I
the
see.
border, that kind of stuff.
We are not having any of those issues. Even in terms of change in presidential administrations and et cetera. The previous administration was always cognizant of the fact that farm workers, we wanted to do everything we could to get farm workers to our ag employers so that you could do what you needed to do. And I'm sure that we're going to continue with that same. We did have some hiccups last year. It took us a bit longer sometimes to get individuals, and we were in the early stages of the pandemic, and they had difficulty with, quite frankly, with their own staff being impacted and infected and what have you. That slowed down everything. So I think we've worked through some of that. We're getting ready to ramp up again, and we'll just see what's happening as it relates to the issue. Our focus on the labor end is that we were stating on behalf of our state here in Delaware and employers is that we did not want to have those delays. We wanted to proceed as safely as we possibly could to not delay your seasons and your work agenda.
With that, I thank our panel. And so I'm going to remove the pens and